Dr. Sajid here again. We are going to be talking about probiotics, a very hot topic, and we'll restrict our discussion to the use of probiotics in children. Now, what we will talk about is what are they and what are their functions, where do we use them, are they safe, and are they effective? So let's begin by explaining to you that our intestines have a lot of bacteria, more than you can imagine. Some of these bacteria are harmful, but most of them are not. And there is a balance that is maintained in the intestines of all people, including children, that gives us proper health. When there is an imbalance in these organisms, or these germs as we call them, we get disease. Probiotics are what we call microorganisms that are present in the intestine but that are helpful to our health, and that is why probiotics. You remember the word antibiotics, which is what kills the organisms or germs, and probiotics are what we call helpful microorganisms. So these are living, these are live bacteria, but they are helpful, and they are helpful to a number of conditions that we are confronted with. So we begin by telling you what are they used in, and I'm sure you know that the commonest use is in children who have diarrhea, that is loose stools. And by now I'm sure you have experienced the use of these in cases of diarrhea. Another use, that is when a child is prescribed an antibiotic, then because of the use of the antibiotic, the intestines can be irritated, and a baby especially, but children in general, can have diarrhea. So probiotics are also helpful in what we call antibiotic induced diarrhea. So these days doctors will often prescribe antibiotic and also add a probiotic with it. Another use, a very common one, is its use in intestinal colic or infantile colic that occurs in the first few months of life. This is when a baby becomes very fussy and stretches himself, passes gas, and is generally crying and uncomfortable, and this happens generally between 6 weeks to about 3 to 4 months of age. Probiotics have been used for this fairly successfully. Other conditions, however, that are used, that in which probiotics are used, are constipation, interestingly, quite the reverse. And I'll explain how that can happen. It can be used in some instances of cow's milk allergy, can be used in irritable bowel syndrome, and now recently the second commonest condition that they used in is allergic conditions. So people use them for example, eczema or irritated skin conditions. Some experience in use in asthma and in related allergic conditions. So as it happens with other modalities of treatment, people have used them in many other instances, but these are not what we call confirmed and pakka uses of probiotics. So they've been used for example, blood pressure. People have used them for lowering of cholesterol. They have been used for immune boosting. They've been used for urine infections. But these are not what we call confirmed uses. And although some people use them, they may work, they may not work. But for diarrhea, for colic, these, and for allergic conditions, they seem to have a beneficial effect. Now, how it works is that it boosts your immune system, your infection fighting capability, and that also works through the intestine, and that is why a child can recover from that particular illness. So these are probiotics. Now, how do we use them? We use them carefully because different probiotics will work in different conditions. So what works for diarrhea or works for colic may not work for constipation, for example, may not work for allergic conditions. So the doctor selects the particular type of probiotic that may be useful, and he has to know which condition to use them in. The second thing that the doctor has to know before he prescribes a probiotic is what is the dose of this particular probiotic. So it comes in billions of units, as we call them. So you have to select the proper quantity of the probiotic, the proper type of probiotic, and lastly you also have to then determine for how long to give it. So for example, I'm sure your child may have had diarrhea, and I may have given you a prescription for 3 to 5 days. Now that is the average duration. In some instances this can be given for a month. In allergic conditions sometimes it's given even for 2 months, and in some conditions people have used them for even longer, for example in constipation. So they are generally given by mouth, and they come in either a powder form or a liquid form, which can be mixed with food or with juice, and for grown-ups they come in capsules. They store well, although we don't advocate leaving them in hot temperatures, and generally once you get the prescription you should try and use all of it in the duration that you have been given. So they are useful and they are easy to take, and the last question that everybody asks is, are they effective? Yes, they're effective. And do they cause any harmful effects? Now, it doesn't cause harmful effects if it is used properly in the conditions for which it is known to be effective. But in some instances it can be harmful because these are living microorganisms or living bacteria. So if you give it to a child or a grown-up whose immunity is very weak, who's got a chronic condition, for example a heart condition or any other chronic condition, which means ongoing condition, then the organism actually can in itself cause an infection, and that can be a problem. Other than that, they are safe, and the only side effect occasionally is, again interestingly, either a little bit of nausea or a little bit of diarrhea. So I hope that you have been able to understand the use of probiotics. These are commonly used agents and they are very popular these days, but a word of caution: please do not use them without the direction of a doctor, because number one, it may not work, and number two, it may cause harm. I hope this information was of some use to you. I'll come back again with another topic.